welcome everyone. I think we have a few more people that are trying to find us and probably finding parking. So Brittany will get them in here. But I want to start kind of informally. This is really just for you for information. Hoping I'll answer all of your questions.
Close the door.
Oh, they'll come in. Yeah. Oh no, we've got a few more people. Oh, they are talking. I won't start until we.
It is introduction.
Let's see here. I just want to pull this up for you. So, how I'd like to start is just if somebody will kind of tell us if I can get anybody raise their hand if you've had or experienced back pain or sciatica in the past 30 days.
30 days. No.
Okay. Beautiful. Can we get somebody to share kind of what their experience is? I'll pull this up real quick and.
I was just about it. It's been all the time in my life. Sometimes I get pain on the left hand side here.
Okay.
Of course, I have defective leg, but.
Did you call it a factory leg?
Defective.
Oh. I love it. Love it. So all on the right side, though.
Yeah.
Okay. I want to learn more about that. Let me
I
find
get all
one.
the time. It's from the childhood. It's there.
What's going on? Where's my workshop? There it is. All right, very good. So will you tell me a little bit about what kind of pain you've experienced and kind of a little bit about what's going on with you?
Give me a minute, I'll get the right words.
Okay.
On this hips, on this side.
Right hip.
Yeah.
Okay. 0 to 10, what would your pain be?
4, 5.
Okay.
Not more.
When does it hurt?
When does it hurt? If I don't exercise.
Okay. Does it hurt when you're standing or walking or sitting?
Stay.
Standing.
When I sit,
Sit.
I can't
Sitting.
sit straight. Spinal cord is bent.
Okay. Okay. And have you done anything for it?
Well, then I sleep on the other side
Okay.
of this side. So the head get pressure, stretch it sort of.
Okay.
That is a short answer.
Okay.
But I sleep on the other side, on the neck, like this. So the neck stretching out and this thing. But I had a car accident also, I forgot about it.
Okay. So how long has this been going on?
Since my car accident in 1990.
Okay. So what have you sought out as far as treatment?
Nothing.
No treatment. Okay. Do you have to take medications or anything like that?
Oh yeah, I have different but not related to that. I have a lot of different medications.
Okay.
But
Nothing for this.
No, nothing.
Okay.
I went to this, like that photo
Oh, okay.
that hurt me a lot. I went to this one doctor here also. What's his name? Oh.
So no success yet. So you're just
No,
looking.
I had a lot of pain. The doctor chiropractic. He did something. He tried to break my bones, but.
Thank you for sharing. I appreciate it.
And then he took me to collection agency for $300.
Oh,
These are questions. Okay.
Thank you.
There is a lot to be
See,
done.
I put my boss.
It is good to keep it.
yes. Anybody else want to share their story? Okay.
It's just, well, I broke my back when 1973, so I've always, after having kids and that, have had back issues, pain, but in the last couple of years it's gotten worse where I had like the pain down my leg and it's in my left side. overworked myself last summer in the yard, and I notice now my pain is in the hip, the left hip. And when it happens, anytime I do housework,
You should stop doing housework.
I
Yeah.
do. Well, and I find just like picking up a basket of laundry, you know, or doing the vacuum cleaner, I can tell that it's irritating it. So I sort of like a couple of days I have to baby myself. But yeah, just it's annoying.
How much pain is it right now?
Well, actually, it wouldn't bother me till on the way over here, and I'm like, what a great time! All of a sudden, you get that pain in your bun.
Okay.
And I would say sometimes it can get up to a good 6 or 7 before I really said, okay, I need to stop, you know, and start watching what I do.
And do you know when the pain happens? Is it more when you bend over?
When I bend over, yeah. And I broke my back in the, I don't know what that actual term is, but it's the lower back.
Okay.
Body cast 2 months and.
Holy cow.
Yeah.
Well, that was back in the
Yeah.
good old days.
And I know a lot of it's arthritis, of course, but.
Sure. So, what type of care have you sought out for it, or what have you done? Nothing yet. Okay. Thank you so much.
Oh, you're welcome.
Can I get
I'm
one
here
more?
for you to fix me.
We can
Yeah.
totally do that.
Prabha. My name is Prabha.
How do you spell that?
P as Paula. R A B H A.
Thank you.
You are most welcome. I had 3 accidents. 2004 bumper hit by 3 teenagers.
They're all car accidents?
Car accident.
Okay.
2010 bumper hit while sitting in the car. In the car, I was parked car. That was second. 2014 again bumper hit while moving towards the stop sign, and the lady bumped it. What I see about my health, the first one whacked me out.
Okay.
It was whooping cough, knees, my head, all of that. What I have done is taking the x-rays while they have seen 2 or 3, I don't recall now which vertebra.
Lumbar 2, 3?
Yeah,
Okay.
here was affected. It was all taken care in Seattle, Washington. I had physical therapy, massage, and doctors, they were showing me, directing me how to curtail my pain. It was extreme pain. And 2008, when I got hit, I had physical therapy and chiropractic. While my knees and foot was more affected, in first one, whole body was affected. In second one, my feet and toes were affected. And in third one, my head, I had gone to eye doctor. He said, your cataract is not yet to be taken out. But as I got hit, I couldn't see.
Oh.
It was Mother's Day. I couldn't see. And I went to the Pearl Vision. They said, your cataract has been affected by the hit. Go Cincinnati Eye Institute. I did go there. They said it is nothing to do with accident. They declined. I know they don't want to be part of this whole scenario. They said you need both eye cataract to be taken out. They measured everything, but when it was time to operate, they took only one eye, replaced it, left the left eye. I had neck, tremendous pain. What you are saying, pain standing, I have all that.
Okay. So how much is the pain right now?
Right now is 4, 5. I'm now pain-proof kind of, who has maneuvered the pain. It is right now 5.
Oh, it's fine now.
5.
Oh, 5. I'm sorry. I'm sorry.
I am never high in my day.
Okay. So I don't have good hearing.
No, I don't.
Okay.
Maybe my speech,
Okay.
my pronunciation.
No, you're great. Thank you all for sharing this information so that some of you others can relate to some of these things as well. Okay. I can get started. Can we? Is it quiet? I think we're good. Okay. Thanks.
It was blessing for me to come here. I was in PRP also, work therapy, and when I saw this, I said I have to get more education.
Get more education.
How to cope up.
We hear this often. I did something with my thing and I can't. My slide. Why is it not letting me move my slide? I'm on a different. Okay, I just have to slide down for some reason. Okay, so we've got that. So I want everybody, I want to kind of introduce myself. I'm Kim Narker. I'm the owner of the facility, and we hear that kind of story a lot. We're trying to reach out to people with these workshops to give them information so that you have good information to make a good informed decision without using medication, injections, or surgery. Okay, so this is all for your worksheets. You take them home. They're not for us. It's just to give you information and to hopefully be helpful to you. This is Dr. Michael Ryan. He's one of our docs here at Stretch Physical Therapy, and he's here just kind of watching the workshops, and hopefully one day will be me up here. We do like a simple test. 90% of the time we can help a consumer. There's 10% of the time that we cannot help, and there are other interventions that are better for you. So we want to see if we can help you, and one way to do that is to test some things. So I want everybody to stand up if you can. If you do have poor balance, please hold on to the chair and don't do anything that can cause yourself to fall. But with us talking about back pain and sciatica, I want you to stand up. I want you to lean forward and then come back up and then raise your hand if you have pain with that motion. Okay, so a few of you. Okay, then I want you to put your hands on your on your sides here. I want you to go backwards, and then I want you to raise your hand if you have pain with that motion. Okay. And then I want you to lean to the side. Raise your hand if you have pain with that motion. Okay. And then to the other side. And come back up. Great. And then have a seat. We'll come back to what you're feeling, but just kind of remember when you do have pain. So now I'm going to talk about the sciatic nerve. Now, I kind of like to draw, and my drawings are not the greatest, so it's all just to help. So this is the pelvis. 2 little holes, which are about right here in the pelvis. Up here is going to be, I know you've probably heard of L4, L5. Okay, so that's up here connecting. Here, does anybody know what this is?
Triangle bone.
Huh?
Triangle bone.
Yeah, sacrum.
I like that terminology.
I like that terminology a lot better. That is, okay. This, do you know what this is? It's a vertebrae. And then up in between each of the vertebrae, do you know what that is? A disc.
Disc, yes.
Okay. This is called a foramen. which is typically, it's a hole in a bone that nerves go through. I can't remember if foramen's M-O-N or M-E-N. M-E-N. So the sciatic nerve travels from L1 through L4, and it's smaller nerves at that point. We still connect that. So the nerves come out in between each of the vertebrae and come down. And when they come down the front of the pelvis here, go out this bone here, okay? And then they go down the back of the leg. At this point here, the sciatic nerve's about the size of a nickel, okay? So coming out of here is when it's larger. These are smaller, and depending on where they're pinched is where your problem is here. So that sciatic nerve can come from there, down here, out here, and then down the leg, and then it splits down and goes this way. It is actually the longest nerve in the body, and it's sort of two nerves that goes down, okay?
Does it go both sides?
Yes, ma'am.
Yeah. Do you know?
Yes, you have two sides. Yes. I've never had that question from anyone, but yes, ma'am, it does.
Yeah, because I do suffer from it.
Both sides. Okay, and we'll talk about that. So anybody go in the summer and take your garden hose and pull it out to spray and nothing comes out? What do you have to do typically?
Go get the kink out of it.
You have to go all the way back to the kink, unkink it, and then take it all the way back again. So same thing with the sciatic nerve. If you follow it to where the pressure is compressing that sciatic nerve, you can fix the problem. Okay? You guys going into these different positions, if you have pain, that is actually a good sign. Okay?
Never knew pain was good.
Pain is good. Pain is good. Pain is your stop engine light. It's the way we know that your body says, I can't handle this anymore. You need to take care of it. Okay? So listen. All right. So let's tell you a little bit about how I came to specialize in back pain and sciatica. So my mom had stenosis. I was coming out of school and I thought I knew everything, and I knew absolutely nothing. But she had stenosis. She would go to the grocery and she'd know where every seat was that she could find. So when we went to the mall, she knew where she could stop because she knew how far she could walk because she felt like she had to be in this position. She was taking medications. She had many, many medical conditions going on with menopausal stuff, weight gain. She was seeing a cardiologist. She was seeing a personal trainer. She was going to Curve. She was seeing a dietitian. She was seeing another doctor for the sciatica. She passed away from a massive heart attack in 2005, and her last words to me were, you got to pull this together because it's very confusing. I have my personal trainer telling me this. I have Curves telling me this. I have the doctor telling me this, and none of you guys tell me the same thing. It's very, very confusing. So after she passed away and I moved down here, I had a lot of people telling me that they had back pain and sciatica and that physical therapy did not work for it. And of course, in my brain, it was, what do you mean? We work all the time. Why doesn't it work? And people kept telling me that. So I was newly married here and told my husband that I felt like I needed to open a clinic to help people with back pain and sciatica. 4.5 years ago, we opened, and the last year and a half, we've been doing workshops for back pain and sciatica every 3 weeks.
Thank you.
Mm-hmm. So it's been very helpful, and it's just to get the word out. Yes, there is hope. There are things that you can do that are conservative, that you don't have to resort to medications, injections, and surgery. You just have to have the right information and have a trusted professional give you that information. So that's sort of why I'm up here today, and I'm growing and expanding. So Michael has joined our team in efforts to help us grow that and get more out into the community. So let's just go through these really quick. There is hope, and you can heal things naturally. So let's talk about common activities that make pain worse. Tell me some of the things that you do that cause pain. And you can just kind of speak it out loud to me.
Standing too long, say 10 minutes is my max now.
Okay.
I can't stand more than 10. I had to sit.
Okay. What else causes pain?
Sitting.
Okay. Anything else?
Walking.
Okay.
Walking, yes.
Anything else?
Cleaning bathrooms.
You should never do that again. Anything else?
Getting out of bed. Getting into bed.
Yeah, getting into bed.
Anything else?
Going up the stairs and coming down the stairs, that is incredible to
Anything
figure
else?
out.
What about getting in and out of a car?
Yeah. Oh,
We hear that a lot.
All of the above.
Getting
Trying
off
to think.
the floor.
Bending, getting down to the floor,
Getting off.
getting up.
up is maneuvering. You
Or out
can't
of the
go.
bathtub or
You can't have no soaked bath. I can't.
That makes
either.
it difficult because you can't get back up.
Yeah, and I have found, like when I overdo it and I start feeling that pain, I feel like if I sit in a hard chair,
Yep.
it helps instead of sitting in a soft chair. So I'll do that for a few days just to try to ease the pain off again.
Perfect. So, excellent. Pain is an indicator something is wrong. So if you have pain, it's your brain saying that, hey, I can't fix you anymore. I've done all that I can do, and it's time for you to take action and do something. Okay? So that's your indicator light. If you have an indicator light come on your car, typically you're getting it to the car shop as fast as possible so that you can get it fixed. In our society, we do not fix anything with pain until we've dealt with it so long. When it stops us from functioning, then all of a sudden it's an emergency. Okay, in our society. I'm trying to back up and get people in a little bit earlier so it doesn't take as long. But even if you wait, you can still get a resolution. So let's talk a little bit about pain before we move forward to talking about sciatica specifically. Because I want you to know that you didn't just wake up one day and have pain. It didn't happen because you possibly did something and all of a sudden your pain is due to that activity. It has a lot to do with your brain and pain itself. So I want you to understand that.
But this sciatica pain which came to me all of a sudden.
Well, yours was an accident too. So,
No, it was after accident. It was a couple of months. All of a sudden I was in, it came, it was debilitating.
Right.
Saturday was the one I could kill myself with that pain.
Yes.
That was extreme pain.
Right. So what is happening? Typically, in our society, you'll get an ache or pain, and it's probably going to be in your 30s or 40s. You'll sit down at night and something's achy, and typically our society says, I overdid it that day. I gardened, or I did this. So we tend to blame something and say, I just need to rest. It'll be good in the morning. And when you wake up in the morning and the pain is gone, you're good.
Yeah.
Okay? And that's fine. That's typically up in this area. This is already your first responses that your brain is signaling there is a problem, but in the background, your brain is fixing things. It is causing compensation. It is providing internal stability, which is arthritis, growing in there. And that internal stability is also turning off muscles and helping you to not move into positions that cause pain. So your brain is already saying, I'm helping you through your day. It's giving you these signals, but we don't react this early on. This is where it's much easier to fix, is when you come to me and say, it hurts right here when I do this, it's easy for me to fix that. That's you're no big deal. That's 4 or 5 treatments and you're done. Now in here is where we get a lot of people. This is typically, now you've stopped running, you've stopped going to the gym, you've stopped walking because you feel like if you do those activities, then it causes the pain, or your pain is worse. So I hear people stopping doing those things because they feel like if they stop that, the pain will go down, okay? Usually it just gets worse because you've stopped those activities, because now you're not moving, and it gives more opportunity for arthritis to grow and for things to occur. It is fixable here as well. Now our society, right here, is when you actually wake up that day and you're debilitated. And then you go, oh, I can't function. I can't go to work. I can't go on vacation. I can no longer pick up my grandchildren. I can't go to Kings Island. And so now all of a sudden it's emergency and you're calling the doctor. From what I've heard in the clinic just over the past 4.5 years, this is about a 2-year turnaround in our area because you go to doctors, you get medications, they don't resolve it because, they do nothing but gork you out and they cause other problems and they don't fix, they actually mask the problem. So you do that and then possibly you go back to the doctor says, well, that didn't work, let's do some x-rays. So you do x-rays and typically your diagnosis is you have a herniation at L4, L5. And you go, great, I have a L4, L5 herniation. Typically here you go to physical therapy, you get some exercises, it may help for a short period of time, you go to chiropractic, you've gone for a little while, it helps for a short period of time, but then the pain keeps coming back, okay? So right here is where people, after they've gone through that cycle of medications, failed PT, failed chiropractic, massage therapy, then they go into the doctor and the doctor goes, there's enough justification that we can do surgery now. And you're going, hallelujah, let's get it fixed. And then that process takes another length of time. Here, through this whole process, nobody's fixed anything. Nobody's gone to the root cause of why you're having pain and fixed it. And so you didn't even get an attempt to fix things naturally because our society is so driven to the other model. Okay? Our model is to change that, to help you heal naturally without pain meds, injections, or surgeries. So let's talk about that a little bit. All right, we're going to jump through. There is hope. If you stood up and you did those things and you had pain, there is hope. If you had pain in all 4 areas, talk to me. There may be something else going on. Or if you did not have any pain in those areas, talk to me as well. Okay, afterwards. But if you had pain, there is hope. That means that it is reproducible. If we reproduce the pain, we can reduce the pain. Okay, that's your body's indicator. It's right here. So often we get people in the clinic and they immediately, when we do a technique, they go, oh, that feels really good. And it's that pain, it's the brain saying, yes, you're right where I need you to be. So our brains are fabulous tools to kind of lead us to where we need to do to heal things naturally. So if you have pain and it's reproducible, it is reducible. All right. So let's talk about the number 1 single biggest mistake that most people with back pain and sciatica make. Do any of you guys know what that is?
Ignore it.
You watched my videos. Yes, we ignore the pain.
I sleep on the pain. I can't ignore the pain. I have to see what brings my body solace. Sleep, which is detrimental.
It's a huge part of the healing process. But you're far ahead with a lot of that because you internally know these things.
Yeah.
Okay. The second biggest mistake that most people make is they alter the pain. And that's typically medications, injections, or surgeries. And in this group, I also put, our society is now, doctors referring people to yoga. And yoga practitioners are they have a certification for yoga, but they don't have the knowledge base that they need to heal sciatica. And I'm getting injuries now, back pain and shoulder pain injuries from yoga. So the people that are coming to me are saying, my doctor's saying I need to go to yoga. And I think that's great, but I think first you need to find out the problem, and then we get you to yoga, so then that's a maintenance type, lifelong thing. We're also getting people seeking treatment from massage therapists, and massage is fabulous, but have you noticed when you have a massage, the next day, you're tight again? And so it's a very short-lived. So you've addressed the signs and symptoms, you have altered something, but the next day, it's back again. And nobody can afford to have a massage every day. Okay? Another form of altering is possibly just going in for stretching or things like that. You'll notice that you stretch, but you keep getting tight. And I have my coaches coming to me. I have other people going, my kids don't stretch. I know I need to stretch. Well, your body is saying stretch because it's saying there's a problem. Stretching is not the only answer. The answer is going to fix the problem. And when you fix that, you don't need to stretch so often. That is, again, another tool that you have to maintain the length of the muscles and things like that. Does that make sense?
It does make sense. This stretching I have not learned anywhere. It is self-taught. Yesterday I was suffering. It was through stretching this leg. My God.
Mm-hmm.
I was able to sleep afterwards.
And stretching's a fabulous tool. It just doesn't fix the problem. Stretching.
Yeah, it doesn't feel. I am here to fix the problem.
Right. This is what we like. We like for you to fix the problem, and then use stretching and yoga and massage and acupuncture and all of our other modalities that you can get in our community that are wonderful to be able to then do what they're supposed to do. Each of them have a purpose, but they don't have a purpose to heal a problem. You have to first find the root cause. Does that make sense?
It does. How about cranial sacral therapy?
Very good therapy. Very good therapy. I love it. I have some great practitioners that I refer to for that.
Is that for sciatica and nerve pain and knee pain and...
Cranial sacral is different, so it's not going to fix the problems that you have going on, but it is a component in healing.
Okay.
Component in healing. So let's talk about the 3 common causes of back pain and sciatica. I can get long-winded, so I've cut out a lot of things. So number 1 cause, herniated disc. Has anyone been diagnosed with a herniated disc?
When I had a first car accident, it was.
Okay, so
Mine's actually at the base of my neck, though.
okay, same premise. I've got a video I can send to you if you'd like to learn more about the neck. We're seeing that more prevalent in 36 to 45-year-olds. So, but same kind of premise. Okay. This is a side view. Have you ever heard of L4, L5?
Yeah.
Okay. So this is L5. So standing to the side. I know these are generic drawings, so I hope they help. This is your spinal cord. Okay. In here, you've got a disc. Okay. Right here. So spinal cord is very heavily protected with, I can't even remember the name of it. What's the thing that covers it? No, it's much. No, the protectant that surrounds.
The sheath.
Yeah, the big, thick.
Yeah, your sheath. Yeah.
Yes, the sheath of the spinal cord. Anyways, so someone with a herniated disc, this is typically our 18-year-olds to 35, 36-year-olds. Because they're tall, typically they've got a pelvis that is posteriorly tilted a little bit. They think that they can do anything. You bend over, you lift stuff. The back bends here. When you've got a pelvis that is a little flatter and you don't have a curve here, then you're already in that position. When you go to bend at the back, then the disc is going to protrude. When it does that, it protrudes, hello, come back. It protrudes backwards into that. This sheath is so strong that it's going to then have to herniate to the side, okay? So that herniation occurs out to one side or the other, because when you come back up, it sort of pinches it out there, okay? That nerve comes down here. So because of that herniation, it's just sitting on top of that nerve. And so that herniated disc can cause nerve pain. Those people kind of feel a hitch and they can't stand up. And the body, what I'm finding with my younger guys, it's sometimes a longer recovery because we're having to return, it shuts off hips and tightens up hips and does all sorts of things. But herniated disc is typically this age group is what I'm seeing, okay? If you have pain with bending forward, it could possibly be a herniated disc. But we're also finding that pain bending forward can also be any spondy type diagnosis. So have you heard of spondylolisthesis or spondylosis or spondylysis? What are all the...
Spondylolisthesis is the slippage, but then you can also get like a pars defect where the vertebrae is fractured.
Which is then we have to be very careful with. So, but pain with bending forward, you can also have a spondylolisthesis, and typically those people have pain with bending forward. Okay? Anybody think that this is what they have going on?
Is it connected with the buns also?
This is typically this age
I
group.
have
So
to
we'll,
stand.
go ahead, please stand up. So let's move on to what we see mostly in the clinic. That's the number one common cause. The number two common cause is stenosis, arthritis, and degenerative disc disease. Okay, so I think it's 80% of people have been diagnosed. It's all fixable, by the way. They did a study out of 100 random people that did not have back pain to see how many would have a disc bulge or herniation on their MRI, and they found that 80% of people have a disc herniation or a bulge that shows on an MRI, but that's not the cause of their problem. Okay, so there's a lot of people walking around with a disc herniation. So if you have that diagnosis, that may not be the problem. Okay. All right, what does this mean? So
How
this
the
is
problem is diagnosed then. If that is not the problem,
then you're not going to get successful treatment if it's not the problem. Okay, and this is a picture on the screen of a bulging disc where the nucleus is sort of leaking out. There is research that shows that that is fixable, okay, and we do see a lot of that here in the clinic. But we're going to move right into typically our what we see a predominant amount of people with, and that's arthritis, stenosis, and disc degeneration. All right. So raise your hand if you have 50 plus candles on your birthday cake. Happy birthday. So stenosis is typically, I'm seeing arthritis in our 35, 40-year-olds. We're seeing that it's starting in the thoracic spine, so here to here. And then this tightening typically will put a little bit more pressure down here. We're also seeing that a lot of hips are tight.
yeah.
Okay, so by the time they have arthritis here and it's not being addressed, then degenerative disc disease, your disc is supposed to be buoyant like a grape. So you pick up one of those nice grapes in the summertime, and it's nice and buoyant, and it's supposed to be your buffer and your cushion in your spine. By the time, we are constantly sitting or standing, so our backs are never in an unloaded position. So you're constantly putting pressure on those discs. And because of that force and trauma over time, then your discs are just constantly, getting pounded on. With age, your disc actually dries up, and it's sort of, as you're in your 40s and 50s, it's sort of like a raisin. So it's shriveled, and you actually shrink as you age. I used to be 6 foot tall.
I was 5'2", I am 5.
So
I don't care, but I want to get rid of this pain and walk.
So this is your disc. So by the time you've gotten older and it's squished down more and this is a raisin, there's not a whole lot of space for those nerves to come through, okay? And if you have arthritis growing in between here as well, typically these people are going to have pain with standing, walking, going up a incline, so walking a hill. The relief for these diagnoses are typically to sit down. Sitting usually takes the pain away because when you're standing up and you've got arthritis in there, you've got a degenerative disc, and this is shorter, there's not a lot of space. So by the time you get 50 and all this is going on, the foramen, another one of those holes, right here, there's not enough space. There's a narrowing, And because of that narrowing, all you want to do is lean over. You want to lean over on the grocery cart. You want to sit down to relieve that pain because this is opening this back part up and taking the pressure off of the nerve. Does that make sense?
Yeah.
Okay. Anybody think they have maybe this going on? Perfect. All right. So the third thing is we're doing a little bit better with the third thing in diagnosing. Used to, I think we've just learned so much more about the SI joint. There's a lot of controversy out there. We've got even PTs that say it doesn't move, but it does move 2 to 3 degrees. So we're going to go to SI joint and pelvis pain. Now, raise your hand if you've ever been diagnosed with piriformis syndrome. We hear that a lot, and it's all over Facebook.
What is it?
Piriformis syndrome. Nope. Okay, so that's good. We typically we hear that a lot, and everybody thinks, oh, I just have to stretch my piriformis and I'm better. Okay, we're going to talk a little bit about that. SI joint. Your iliac crest here. Foramen. This is your sacrum.
Or triangle bone.
Or your triangle bone, because that's my new word now. Okay. L5, disc, L4, and it goes up. I know these drawings are not great. And that sciatic nerve goes on both sides. So we're going, okay. So what I'm seeing is thoracic spine is not moving. Lumbar spine, we now have degenerative disc, or we have stenosis, or you have arthritis that's in there. So a happy spine wants to rotate, wants to forward bend, wants to back bend, and wants to side bend. Because arthritis grows in between those two spaces, it locks it down, and so it doesn't move. The joint actually sends the response to the muscles to tighten and hold. That's why you have AM tightness. You get out of bed and you think, oh, this is so tight. And then after a little bit, it goes away. That's because you're moving and you're able to break free the arthritis. Over time, if that grows, it sort of seals those together. And no matter what stretching you do or other things, the damage is done because the muscles have atrophied back there. And now you're compensating. And so the reason you wake up that one morning and you move and do something wrong, your body hits that nerve and then your brain goes, I'm done. I'm done. I've turned all of this off. You've been dealing with this too long. It lowers your pain threshold, and you then feel everything until your brain says it trusts what you are doing. Does that make sense? That's why you wake up one day and you go, I didn't do anything yesterday to cause this pain, and it doesn't go away. Now, in traditional physical therapy, you go through and you get relief, and it's short-lived because you didn't fix the problem over a length of time. And if you don't fix the entire problem, then because you have arthritis, disc degeneration, or stenosis, and it keeps growing, arthritis grows every 12 to 16 hours. Okay? So you leave your chiropractor, you leave your chiropractor, you leave your physical therapist, and you go home and you go to sleep, and you're gone for 2 months, and the pain comes back. It's growing all the time. You have to be taught what you can do to keep that away, okay? To keep everything moving freely. Now, if thoracic spine does not move and lumbar spine doesn't move, the lumbar spine will send the response to the hips to tighten up. So then you've got hip tightness. And we're seeing with people with stenosis, they're taking smaller steps. Hips aren't moving good. So if you think about your pelvis being your foundation of your house, and you've got concrete cinder blocks stacked on top of things, and then the cushion is there, over time, something has to break. The pelvis, because it moves a little bit, is that breaking point. Okay? So someone who has SI joint pain, typically ages 35. My oldest has been 96 with SI joint pain.
What is SI?
Sacroiliac joint. This joint right here, between the triangle bone and the iliac crest, is called the SI joint.
SI joint.
Okay? What happens is because of all of this tightness and the hip tightness, the SI joint sort of rotates because something's got to move. When you go to do these activities, something has to move if everything else is not moving. So, SI joint is typically 35 to 96. This is typically pain with sitting, pain with rolling over, pain driving a car, getting in and out of a car, getting up and down from a chair. That's typically an SI joint pain. We have to rule out if there's a hip that's tight too, because that can be pain sitting long distances. But this is typically what most people complain of. Okay, so you can have stenosis and an SI joint. You can have both.
I was going to ask you, if you don't take care of like 2, what number 2 was, can it go into number 3?
There's no research to support it, but I am seeing that in the clinic. I'd love for there to be research studies. Hint,
Well,
Michael.
The
But
reason why I asked that is because I've always had back issues, having it injured, but it was always just less pain and just more in the lower back. But now I have that.
But it may or may not be, okay? You have to rule out some things just to let you know. But we're seeing a lot of these, the earlier ages, it's typically, we're seeing a lot of ladies that their doctor tells them after pregnancy, it'll go away after you have the baby.
Because you lose that weight. And all
Exactly.
that
And then they're coming to me 15 years later going, it never went away. So we see a lot of SIs that either the pelvis is forward or it's hiked up on one side, which we call a pelvic upslip. There is some research out there that shows that this could have happened a long time ago. Maybe you stepped down too low, or you're playing basketball, although there's a sport and there's a constant loading on that joint. And I'm even seeing in my younger kids, we're getting basketball players, we're getting baseball players, that I think because they're getting a lot of weight and putting it on their shoulders and going back and then arching back, they're hitting a facet, locking up L4, L5, and then the hip joint's tightening. And these kids are not running fast because they're tight, but it's because of all of this stuff. So I think we can back it up and trace it in a few years, but that's just a hypothetical thing on my side.
If you have all those symptoms, but I have an additional thing that I can be walking, and all of a sudden I'll get a sharp pop, just a second, and it gives me a second of additional pain.
Okay, so that could be the breaking of the arthritis, and then something's moving, and now that movement, your body doesn't have an external support. So it could be a number of things. So can anybody relate to this?
Yeah.
Okay, good.
I'm in the air. I don't know what.
You are body
All I was told after X-rays and that is arthritis buildup, but it's gone too far now, I think.
So we went through these things. This is the sacrum. A picture up here. This is sort of where it bends. We're seeing new research that even earlier in life, this is adhered a little bit over here, so the only movement is happening on one side or the other. So there's a lot of new things coming out with the sacrum and the SI joint. But we're pretty confident we see a lot of them here. So can anyone relate to any of these 3 scenarios? Good news, you're fixable. Okay, you're fixable. Let's talk about the key to successful treatment.
Very good. That is the
hope. That's the hope. Yes. Key to successful treatment is finding the root cause of the problem and then assisting in the body's natural healing. Your body knows what's going on. We don't know what's going on, meaning personally, you know something's wrong and you know the medications and other things are not helping it. So we assist the body in healing. Now, 3 treatments that have stood the test of time for treatment of neck and back pain. This is what you have to do to successfully treat it. Number 1, manual therapy. And when I say manual therapy, that doesn't mean massage. Massage is great, and I think we should all have massage. I want one every day. It doesn't fix the problem. You fix it and have massages That is good. Manual therapy, you need to make sure you're getting grade 4 and grade 5 mobilizations. Okay? Right after someone goes in, so what we do traditionally, let's just talk about stenosis as an example. We're going to go in, and because the body is, the disc and the vertebrae are stacked and you've got arthritis in between here and it's not moving, we're going to go in and put a rotational component on it and hold it there and take it a little bit further each time to get that arthritis to break down. Now, arthritis grows every 12 to 16 hours, so then we give you things that you can do to move that joint and isolate it AM and PM so that you can keep it from growing back. Now, when it gets down to your L5, it's hard to move that. Sometimes you need some manual work to get that going. But when you do that, directly following the manual therapy, and this, when I say this, if you've got back pain and sciatica, you don't have someone just addressing the back. They need to look at thoracic spine. They need to look at lumbar spine. They need to look at hips as well. All of those 3 components play a part in back pain and sciatica. Once you've got that, then neuromuscular reeducation to refacilitate muscles that have laid dormant because there is a joint problem. And there's typically 4 or 5 of the deeper surfaces that you've got to refire so that those big muscles don't feel like they're supporting you. So this is your second thing. Third thing that we've seen, laser, dry needling, stretching, and then a program that goes through 3 phases of care. And that just means you find the root cause, you thoroughly fix the root cause, and then you have to go through and strengthen every muscle that was affected. And when I'm talking about every muscle, I'm talking about the little bitty muscles that support the spine, your glute muscles, and then from there you need to make sure your abdominal muscles, the proper deep muscles that are shut off like transverse abdominals, are actually firing correctly, and then glute medius. Okay? Once you've done these things, sometimes, you've heard of decompression, sometimes with stenosis, traction is beneficial.
What is traction?
At a chiro's office, they call it decompression. Mm-hmm. It's when you're taking and separating the joint this way. Okay. It's successful that it takes the pressure off of the nerve.
Yeah.
We're seeing with that and the rotational stuff that we're breaking through it, and that's the difference. Okay?
Both of these have a certain element which we use. Do you use certain apparatus?
We use our hands. And we do manual work. We're going into every single joint because if every single joint is not moving, then that's going to cause a problem and cause the brain to then do something else. So we're making sure all of the joints from the right here to down here are moving correctly.
So it is manual, nothing other than manual.
Right.
Okay, thank you.
Yep, and then it's education. Then it's education. It's then educating you how you can keep it away. And if you can't, we're here to help you. But we want you to be successful in managing it. And if you're more aware, then you know something that's going on. You can give a call and say, hey, I need to come in for 5 minutes and then be done. We do that as well.
Nerve and muscles.
Okay. Some of the questions that you guys sit in, I want to go over a couple of them. How can I control my pain and what exercises can I do? Again, you have to find the root cause of what the problem is, and then we actually can establish a program so you get back to the gym, get back to running, things like that. Who is in a 9 out of 10 daily? Somebody was. They must not have been able to make it. Wow. Okay.
What is 9 out of 10 daily?
Meaning they're in such severe pain that they can hardly function. Is that you?
I do function, but it is not functioning. It is, I push myself.
Okay.
That is why I want
That's
to
a problem.
ask. Yeah. It's a tremendous problem. I have curtailed everything. My life has come to zero.
So this one is what are benefits and the do's and don'ts of a chiropractor and when to use one for back pain. We are very collaborative with chiropractors. Chiropractors actually refer people to me because we can focus on every single joint. When they go in for their manipulations, things are moving better. So we have this location in Mason, and the reason I'm in Mason is because one of the chiros down here said, I want you to come in business with me. So I didn't. I'm renting space over there, but we're in that space because a chiropractor says the people that come to you, I have better outcomes.
It is cooperation. If it will heal humanity,
yes.
It is all for that.
Say again?
Okay.
I'm Dr. Hazara.
Okay. So how do I loosen my back and hips to get rid of stiffness? That is, you go to the root cause, you find the root cause. If you address that, the stiffness will decrease.
Root cause.
Okay. Are there any other questions?
Yeah, the dry needling. Can you?
Yeah.
I'm a little bit down.
Yep. Absolutely. Raise your hand if you want to fix this problem right now. Okay. Brittany, head out to Brittany. She'll take care of you and get you signed up, and she'll get you fixed. Okay.
When you say right now, I know there's like where you go the next step, and they, you mean just make an appointment?
Mm-hmm.
Yeah, okay.
She has a few this week that she can make, so we limit that to people who need the fix right now.
I didn't mean if you meant like the actual check thing right then. Or
oh no.
Okay, because my sister's in a lot of pain today, and I don't want to, but not.
It's just to get you fit in on the schedule is all.
So your suggestion is make an appointment now. If I am in pain, can I get now for my bun and legs because I am in pain?
I can't treat you today,
okay,
but I can get you on the schedule to be treated.
Okay.
And if you get evaluated, then they'll treat you and you'll feel some relief that day. The first
I
treatment.
have a question.
Yes, ma'am.
My husband had what they call angulospondilitis.
Mm-hmm.
What is that? Is that got a lot to do with this kind of thing? I mean, he could not.
Are you talking ankylosing?
Well, I didn't know how to pronounce it.
Okay.
But he was fused from the neck to the tailbone.
Okay.
And he could not turn his neck, either way. So
over time, what's happened is that the facet joints along the side of the spine have kind of started to fuse together. So that arthritis is built in so much that his spine is almost self-fusing.
So their facet joints are in between here.
Yeah.
They kind of.
Well, why I'm saying is he's passed now, but he fell and broke his neck.
Mm-hmm.
And the doctor said that if he was like a tree limb, that would not give. So when he fell, it just cracked it. I mean, it just busted it wide open.
Mm-hmm.
Where if it would have been loose, it would have given a little
right.
bit.
Yeah.
With him being fused so much,
mm-hmm.
It just really did a job on him.
And then unfortunately, when you're in that kind of state, like Kim said, the muscles aren't functioning at a high level, so they don't absorb the pressure. So your muscles are like an inherent shock absorber. They can help take the pressure off that joint and that spine. But they shut down because of the pain that's generating from the middle of your back. Your spine is your core. It's everything.
He drove a semi for 57 years.
And that constant pressure, those bouncing.
Yeah, those
we see a lot of it.
Mm-hmm. So there's a lot of degeneration that happens over time.
Mm-hmm. Do you want to speak about what dry needling does?
Yeah, sure. So dry needling allows to get to those soft tissue structures that I can't get to. Like if you think of, like Kim said, the kink in the hose. If you have a muscle knot or scar tissue or something that's adhering the way you're moving, that needle, it's very small.
Here's one right here, Doc.
That gets, and you can even pass it around. It's a very small little needle, and there's a plastic sheath around it, so that's not how big it is. But it gets down into that deep tissue and helps break it up. I can't get to it with my fingers.
I've had acupuncture before, and it helps a lot.
Yeah, so it's very similar. Yeah, except dry needling is not the end all be all. You have to first get the joint to move, but then once that joint moves, you're still going to have some of those soft tissue structures that are a problem.
On.
Yes.
Mm-hmm.
This gets down into there. It's invasive. It's the only thing that I can't get to it with my fingers. I can try to, a little massage, but this will actually break that tissue up.
You pop your nut.
Yeah, if you think you got that knot, that needle goes into that knot and will release it. I've had people that cannot turn their head to the left. And I've put some needles into right around their spine and the muscles on the side of the neck. And after doing that, I have them sit up and their head turns. Because
So
those restrictions are, I'm sorry.
So he doesn't do that like on day one. We're addressing the joint, and then that's down here a little lower. The other thing is a deep thermal laser. We go into the cell. The cell, when you have an injury, lies dormant, and the ATP process, and I know this is like, I don't know what you're talking about. ATP process and the oxygen stops because of the cell laying dormant. This machine goes down into the cell, opens it back up for that process to help again, and it starts the healing process, which is different. So we found that with these components together, we've seen a solution of long-term benefit.
Sorry, but I follow. Is dry needling better than acupuncture?
It's just it's a different philosophy. So with the dry needling, acupuncture is all over the whole body, and they just kind of let them sit there. Okay. The dry needling, I'm finding the spot that's causing some of the restrictions. I'm going to put the needles in that area, and then I'm going to also use some of the neuromuscular re-education and some of the other exercises to facilitate what I just did with the dry needling.
Okay, I probably will like to know more if there's a write-up or something on the dry needling.
Yeah, we can give you more information and stuff on that for sure. But
I won't take any evidence.
so yeah, but at first, like Kim said, you got to get the joint moving first. You can dry needle all you want, but if you don't fix that joint from moving appropriately, then the dry needling is just going to be kind of a band-aid over time.
I have a question for dry needling to bone on bone. Does it work on there also on knees?
It can work on, so it doesn't relieve the bone on bone.
But the laser does.
Yeah.
Yes. And then there's a doc that we also have, that we're also affiliated with, that she actually can do some PRP and do regeneration stuff in there.
PRP, I'm aware of.
Yeah. So there's a lot of people that we're connected in the Holistic Society that we can, if there's a problem that needs cranial sacral, or if there's a problem that needs myofascial release, or if there's a problem that needs other healing methods, we're connected with those practitioners as well. If there is anybody that is kind of unsure and you just want to learn what your problem is and what successful treatment looks like, then we also have a $25 consult that Michael can go through, and he'll tell you what your problem is and what successful treatment looks like. It's a $25 cost, but you walk out with knowing what you can do, and you can take that information and do what you need to with that.
I will make that appointment with Michael.
Okay.
It is telling him whole story.
Right.
And
Well, the front desk will get your whole story, so he has it, because he'll only have a short amount of time, and he wants to get in there and test things out. For you.
That way we can spend more time working on it instead of talking about it.
That way I have the plan,
Right.
because I want to walk.
Yeah.
I want to do things. I am vegetating and deteriorating. I don't want that to happen.
Yeah. You've got to get that cycle stuff. I think you probably need more of the initial eval, because then you get an hour with him, and he can test things out to find out what's going on.
I need your number.
Yeah, should I just put my email on there too?
Yeah, absolutely. Yeah, write it on the thing there.
Do you guys make appointments from here for the Mason?
Yes, we sure do. We have limited hours in Mason, because I'm growing, and we hired another PT, but she won't be here till June, so I'm just kind of busting at the seams. Do you know where Kings Island is? Okay, so you take Western Road right under 70. Is that 73? 71?
Yeah,
Right past there, in that little bitty Sunoco shopping center, there's a building with Elite Chiropractic.
So when
I'm in
do
that
you guys
building.
here, like Saturday?
Our hours are
It's a
not
much
on Saturday.
smaller facility, but we pack up and go over there until we have another therapist, and then we'll separate the two and have more hours.
Rochester. We're still getting all the hours and everything adjusted. Yeah.
So you're here too, right? She can come to see you here.
Yes.
Here or
I'll
Mason.
be
Right
here
now
or
we're
Mason. we're
gonna
kind
be
of
going.
going back and forth.
Okay.
Mhm.
All right. So we'll call and then find.
Yes.
Okay.
Yep.
Perfect.
Thank you.
Yeah. No problem. Is that Steve?
Perfect.
You guys are covered for insurance, right?
Yes. Mm-hmm.
For Medicare?
Some of the things. Yes.
What is Medicare?
Yeah. Now, Medicare, you have to have a prescription for your doctor, so you have to have that first. If you don't, we can do a consult, and then we can send it over to him to get a signature.
Yeah, let us first have the plan.
the consult, and then take it over. We can do that.
Yeah, that is the best way to know how to tackle
schedule
this
if you wanted a
situation.
consult
Yep,
or
yep, yep, yep.
evaluation
Let me
for
tell,
someone
um,
to set it up for you if you just had a
What's the
question.
difference between the two?
So the consult is just a
For
$25
consult, what
kind
I
of come
have to
in, I
do,
can answer some
make an
questions,
appointment
kind of
right
tell you
now,
what
or
I think
Tell
really needs to be
Brittany
done.
up front that you
Evaluation
want a
is
Medicare
an hour
consult.
long where
Because
I
we
will
have
be
to do a
able
different
spend
thing than
more
we do
time
with
Okay.
traditional
with
insurance
you,
with
what's
that.
going on,
Yes, sir.
kind of like
Thank you. Is that okay? My pleasure.
it was
the evaluation,
We'll take
will
care
we
of
go through insurance? That's a good question to ask for Kim. Insurance-wise, I don't have that exact number off the top of my head. But
Because
Kim
of the
or
shift,
Brittany
you'll
up
get
front
that.
can
It
answer
can also
that.
be
But
pressure that
before you
you're
leave, I
sitting
can just
a lot.
ask her real quick.
Well,
I'll
I
have
only
one.
notice it like if I'm sitting for a long time or if I'm sitting in the chairs like this without the
Cushion on it.
without the cushion.
Mhm.
Like
And I'm sorry, I didn't catch your name, sir.
Well,
I'm sorry.
Well,
It's just like
nice to
this
meet
stiff.
y'all, Michael.
Yeah, that's typically SI, but it doesn't mean you don't have another component of.
Well, I think I have all three.
Lucky
I've had the
you.
MRIs. They said, well, you've got the disc degeneration. I have the bulging disc, the L4, L5, and then no one could really figure out what the tailbone pain was.
There are some different things you do. It could be many things. It could be scar tissue. It could be arthritis. You just kind of have to peel away the layers for that. But a lot of times there's a rotation deep in there, and
He was asking about the cost of evaluation.
so like for a full initial
Yeah.
eval or an exam,
Yeah.
just, well, I don't know, whatever. Not the
So-
$25, whatever the next.
it's
step is.
$150. It's
Okay.
$150 for that, and that's comprehensive. So he's going to dive in and find out what the root cause of the problem is,
Mhm.
what successful treatment is, how to fix it.
Mhm.
He's going to work on you that day
Mhm.
and give you exercises that day.
Okay.
So it's you're going to feel some relief
Mhm.
before you leave
I
that
mean,
day.
what about ongoing costs for someone who's, evaluated?
I won't know until he looks at you and tells me what's wrong.
Okay.
Okay. Once we do that, then we sit you down and they'll go over everything and
The
tell you
treatment
what
plan
it
and
is.
the cost.
Exactly.
Okay, great.
Yeah, we really don't know until he dives in and
Mhm.
says, "Hey, this is the problem."
Right.
Then we can give you the information.
Okay, great.
Okay.
Thank you.
Thank you
Appreciate
very
it. It was
much.
nice meeting you.
Well, we might have to help Brittany. They
Yeah,
have to
okay,
stand in
okay.
line.
My doctor's across the street.
Diani.
Yes.
Yeah.
And so when I see her again, I'm gonna ask her to refer me over here.
You don't need a prescription.
Do you do your
Okay.
consult
Through my
over in
doctor.
medicine as well?
Yes, I believe we'll start doing that.
Oh, you gotta.
Flipping
Yeah,
I'm
yeah,
a
yeah.
back and forth and
disabled veteran, so I got.
You're the woman that I
If you
attend
call and
days.
schedule with,
It's, I just,
Brittany, then,
Okay.
So-
Yeah.
we'll be able to.
so I, so when I go see her, I'll let her know.
Okay, so that's easier for you to get over. Just,
Yeah.
I kind of live over in Oakley, so Mason's easier for me too. So I
Nice meeting
understand.
you. Thanks so much.
I forgot, you said that you guys do the Medicare. Did you do Medicaid too? Or
I'm
no
not in
Medicaid?
network with Medicaid.
Okay.
I'm not, but we've got finance-free payment plans, and if we have to spread it out over time to help you afford it, we do that.
Okay.
I mean, we just want to fix you. We don't want to break the bank.
Yeah.
So you may have to do more things on your own and come in to see us a little bit less so you can afford it, and we do that.
Okay.
Okay?
Okay.
Yeah. We offer
All right.
every way available to you.
Okay. All right. Thank you.
Thank you very,
Yeah,
very
have a good
much. Let's see how
Do you
she's
need
doing.
it? Yeah. Sorry, is she hanging in there?
And then answer their question. That's perfectly fine. Yeah. She's got it in here, I think. So answer any question. Was that helpful at
Yeah,
all?
yeah, that's great.
Okay. Okay. So that's kind of how
Yeah.
we do it.
Do you have a question for me, sir?
Yeah.
Sure.
I go to all the different dental exofunction.
Okay.
But if Newton can do my job, I don't have to go back.
Yeah, we can address some of the issues as well. So let me show you exactly where I'm working.
I